Hello everyone, my name is Joe and I'm going to be your instructor for the next few classes. What we're going to do today is we're going to orientate you to the room. I'm going to show you the equipment, how it runs, how it works, how to program it, and different moving parts that you all need to understand. This is an actual x-ray room. This is the table. This is the x-ray tube. You have a bucky. This is a table bucky that comes in and out. And then you have an upright bucky, which is over here. We're going to be we're dealing with computerized radiography, CR and DR here. So what the first thing we're going to do is we're going to show you how to energize the cassette. This cassette can be cordless or you can plug it up, either or. We're going to do it without the cord this morning. So we're going to use a battery, so I'm going to put this plug away. And we're going to use the battery, so I'm going to show you. This is the CR cassette. It's very expensive. This thing has a computer on the inside of it. Most departments only have one cassette because this is worth a lot of money. This is worth between, I've seen them as high as $45,000 to $50,000. So most departments can only afford one. So there's only one size, a 35 by 42, or actually a 14 by 17 inch cassette. So we're going to go to the back. So we're going to take the cover off that protects the inside computer system, and we're going to put the battery in there. So that has to be in there in order for the cassette to be activated. You're going to see the green lights come on. That means you'll be ready to go and take your x-rays. Now remember, this has to be handled gently because it's very costly, and this is reused time after time again. Now we're going to go to the orientation of the actual equipment. Like I said, this is the table, this is the x-ray tube. I'm going to show you first how the table functions. In this particular room, and it's going to be a little bit different wherever you're employed. Here in this office, I'm going to show you what we have. We have a four-way floating table, which means it has different release buttons. Here you see all the instructions. You have the release, the up button, the down button, and the all release again. The release buttons are coordinated with the buttons here on the floor. If you see where my foot is, if I hit the all release, the table is all release where it floats four ways. It goes up and down, longitudinal, transversely, which is across, and then it can go down or it can go up. Now the way that I'm standing is going to be the way you're handling the table. So if I want to move the table with a patient on there, I'm going to grab a hold of the table with my thumb and my hand here, and my right foot hitting the all release, which releases the locks. So as you can see, I've released it all. Very easy. Okay? The table also has a table bucky, which is right here. This is where the cassette will fit in. You'll unlock it right here with the lock switch. You'll put this in either transversely or longitudinally. Okay, you'll lock it into place. Okay, that's putting the cassette in the bucky. Now, this bucky will also move. I'm going to release the table so you can see some of the contraptions. There's a button here and a handle with a button where the bucky will move up and down the table. That's longitudinally up and down the table. Okay. Now I'm going to show you how to handle the x-ray tube. This is the x-ray tube. It has two handles, and all x-ray tubes look a little bit different, but they all work the same. The way you handle this particular tube, you want to handle it at your height. In other words, you don't want to handle the tube with it way up here because you're going to end up bending your back, hurting your shoulders. So what you want to do is bring it to your height to be able to move it. Here you have the buttons. This is known as the tube head. As you notice, it has the all release button, the vertical button, and the longitudinal button. It has a transverse and a roll button. Here you have your angulation. This is how you angle the tube cephalically or caudally. You're going to learn that terminology in other classes as well. You have your collimators. You have your collimator light, which turns on here. Gives you the light field or the field of view for the radiation right here. So you'll be collimating using the collimator buttons. See how the field of view changes? It gets smaller or it gets bigger. That is limiting the x-ray tube or the x-ray view to the body part that you're x-raying. Okay, it's part of radiation safety. Okay, so I'm going to show you how to hold the tube. Generally, it's best to hold it with both hands. You're going to hit the all release with your thumbs. So you see my thumb positions and my hand positions. This will release, the all release will release the tube to move all ways up. Vertically, transversely, longitudinally. The only thing it won't let you do is roll the tube. It's still locked. So if I hit the roll button, I let off the release buttons. I hit the roll button, and I can roll it this way, or I can roll it back. Okay? And as you see, the dial changes here, your angulation dial. Okay, so that's very important as well. So, as you notice, as I'm moving the tube vertically, we have the column, the vertical column here. This is very important. The numbers up here at 40 inches to the tabletop, that means the top of the table. And then you have the numbers, the 40 inch to the grid, which is the table bucky, which uses a gridded technique. We'll explain all that in the lectures to come as well. So this is very important. We also have a tape measure that comes down. So when you're doing tabletop work, you can do the measurements as well. And now that we're talking about measurements, let me tell you that every body part is done at 40-inch distance, whether it's on the table or whether it's on the tabletop, or whether it's in the bucky or whether it's done in the upright bucky. 40 inches. There are only two body parts and two procedures where the distance is 72 inches. Now I'm going to show you the 72-inch mark. If you look at the top rail, okay, you have a 72-inch mark and you have a 40-inch mark. Okay, the C-spine, the lateral C-spine, which is the lateral view or a side view of your neck, is done at 72 inches. And then your two-view chest x-ray, which will be PA or AP, and a left lateral view. Those are the only two procedures that are done at 72 inches, and those are usually done upright because you can't get 72 inches on the table. So you would roll the tube, okay, you would all release it. See how I'm handling the tube with one hand here, moving it to 72 inches. Okay, now we're going to go to the upright bucky, which is the other part of this equipment. So as I'm walking across this way, this bucky is the same as the table bucky, except that it's in the upright position. It has a black button here that you will punch, and you can release it to go vertical, up or down. Once again, when you're dealing with bucky work and tabletop work, it's very important that you center. Centering is going to become very important in your positioning of your body parts. So we're going to center this upright bucky to the x-ray tube. Now I'm going to show you how to do that. We brought it to 72 inches. I wanted to show you how to center it. We're going to hit the collimator light. So I'm hitting the collimator light. You'll see the light appear up here on the upright bucky. I'm bringing the tube vertically down. And as you notice, I hit the all release because with the all release, you can do anything you need to do. You can move it back and forth. You can move it up and down the table longitudinally or transversely now, or vertical. So I'm going to center it to the upright bucky. As you can see the black lines, which are right here. I'm going to use my little pointer so you can see the black lines. I'm going to put it off center so you can see the cross. You see the cross right here with a red laser? This is the cross to the upright bucky. This is where you're going to center. So the tube has a centering point to the bucky, to the upright bucky, and to the table bucky. You hit the all release, and if you hear the tube, you're going to hear it lock into place once it's centered. That it should center both black lines, so this black line to the tube, to the bucky. So listen to this. Okay, that's centered right there. See how I brought it down to center across this way? This is going to be very, very important when you do bucky work. The x-ray tube and the upright bucky or the table bucky has to be centered. If you do not center it, you're going to miss the x-ray. Tabletop work's a little bit easier than that, but I just wanted to hit on those points. So remember, when you orientate yourself for the procedure, you're either going to do it at 72 inches, which is only the lateral C-spine and the two-view chest x-ray. Everything else is going to be done at 40 inches. So let's say I'm doing a shoulder. I'm going to do it at 40 inches. You'll see me bring it into 40 inches. And you'll notice, see how, this is just something else that comes up. You see how the collimation became tighter? Okay? So as you bring it back, your field of view increases. Look at the lights. I'm going to turn out all the lights here for a moment so you can see. So you can see the minification and the magnification from the source to image distance from the sit. Okay? Also, you can do that with your body parts. So if I'm doing my hand, you must also remember that when you're doing the body part closest to the x-ray, to the cassette, to the Bucky is the part that's being x-rayed. So if I'm doing my hand needs to be on this equipment, or it needs to be on the tabletop equipment. If I'm doing my shoulder needs to be close to the board. Okay, so just keep that in mind. The side closest to the board, to the x-ray plate, is the side that's being x-rayed. I wanted to show you the difference between if you're not centering correctly with your body part. So if you'll see my hand here, how close I am, okay, you'll see that there's very good detail around the digits. If I bring my hand off the plate, look at how much bigger my hand is getting. Okay, that has to do with your source to image distance. See how it's magnified? That's very important that when you x-ray a person that you get them as close as you can, true to size, and a lot more detail. So that's very important. So you learned how to move this Bucky up and down. That's the only way this Bucky moves. And you're going to always center. Remember the centering. If I get it off center, see how it's off center now? I'm going to center it to the middle and bring it across with cross on cross. Same thing with the table Bucky. We're going to do that as we get into the classes. So basically, you've seen how the tube works. Grab it at your height, all release with your thumbs, or if you just want to move it one section at a time, vertical, lets you move it vertical. Longitudinally, up and down the table from head to foot. Transversely, see how I'm handling it with my thumbs, transversely across the table. Or you can roll and angle the tube. This is tube angulation. Okay, so this is basically how the table works and the tube works with the upright Bucky and the table Bucky. Okay, now that I've showed you how the equipment works and how it functions, we want to talk a little bit about radiation safety. We have full body lead aprons, which you will always put on every patient. Radiation safety is number one. You want to put this on their body. If you're x-raying their hand, the upper extremity, if you're not x-raying the trunk of the body, then you need to shield them. We also have a thyroid shield. Let me get the one that matches. And you would put this across their thyroid area, which is right up here. So this is shielding for the patient. If you're having to hold the patient, you would need to shield yourself as well. Hopefully you don't have to hold as much. We have the shielding for the men also, which this will go across their reproductive organs as well. We also have left and right markers, which every film, every image that you do would need to be marked right or left. We also have leaded gloves. So if you're having to hold a patient, you can put these gloves on and to protect your hands from extra scatter radiation. Okay, the next part that I'm going to show you is the console and the workstation. Right now I'm going to show you the console. This is known as the console. Some are big, some are small, and they're all a little bit different. And what happens is on this console, you have the main anatomical position menu. It has listed all the body parts, and like I said, all equipment at different offices are going to be a little bit differently, but basically the same. Here we do a lot of upper extremity, so you would go to the upper extremity, go to that line and hit the arrow button, and then all the procedures will come up here. So let's say I pick a hand. If I choose to do a hand, then the hand technique will come up. We'll get into technical factors later on in the lectures. As you can see, the KVP is at 55, the mass is at 1 centimeters, thickness of the body part is at 7. So the inches, source to image distance is 40 inches. The film screen speed is 400. And it tells you here at tabletop. So this is true of any of the body parts. So I can change it. by going back, and I can go to the skull. See how I'm going up to the skull? The views of the skull show up. If I go to the AP, you see the technique has now changed to 77 kVp, 12.5 mass, 100 MA, 18 centimeters, 40-inch distance, and it says here table grid. I want you to remember that anything that is 10 centimeters or bigger will be done in the grid, which means a little bit more radiation. Okay, the way you make the exposure is you use 2 fingers. You're going to hit the prep button. Okay, when you hit the prep button, you're going to see that it gives you instructions up here. So I'm going to hold it down. You see the green light flashing? It's a solid light now, and it says it's ready. Once I hit ready, you're going to hit the X-ray expose button, and you're going to see a little yellow light come up, and you're going to hold this down at the same time till the exposure is completed, and you'll see when it stops. Okay, so you saw when it stopped, the yellow light went off, and I lit up both at the same time. When the X-ray's taken, it will show up here in the workstation. So what I'm going to do now is, this is all going to be different for every body part. It should be programmed. I just wanted you to be familiar with this. So we're going to go and we're going to put in a test patient. So I'm just going to put it in as a test. Patient's name is a test. You always have to put in the gender of the patient, the birth date, and the requesting department, which is generally the physician. This is very important. You double check the date of birth and the name of the patient for making sure radiation safety #1 and making sure that you have the right patient. We're going to hit the green button here. It's like I said, this part is going to be different, so we're not going to go into that big of a detail into how this process works. So let's say I got the information in here. Now it's asking me, I didn't put the patient ID has already been put in. Do I wish to overwrite? I'm going to hit no. So once I hit no, you see the test patient's name, test came up here, ID is up here as well. Now you have the different body parts. You have the upper extremity, spine, head, pelvis, chest, lower extremity, abdomen, and pediatric patients. Under the upper extremity, you have the different body parts. You have the finger, the hand, the wrist, the forearm, elbow. You go to the next page, there's 3 pages here. Go to the next page, you have your shoulder, you have your humerus, clavicle, your scapula. Here are special views that we do here, so those are done in yellow. 3rd page, you have neutral views, scapular views, all different kinds of views. If you go to the pelvis, you're going to see the AP pelvis, the pelvis frog leg, hip AP. You're going to see the femur AP, the lateral of the femur. So as you hit the different body parts, the different views are programmed in here for you. Just like the console here, the techniques are programmed in you for what's optimum for this machine. Once you choose, let's just say we're going to go to the upper extremity and we're going to choose a hand. I'm clicking across, I'm going to do hand. The standard views for the hands are the PA, oblique, and lateral. See how they appeared up here? That's what I want to do, 3 images. I'm going to hit the green button to go. That's starting the study with the patient's ID and the view, starting with the PA as well. You heard the green button and that little beep up here. You also see that the battery is fully charged that we put into the cassette at the beginning of the lecture. Once the green button has been lit up, you're ready to take your x-ray. So we'll get into this section after this in just a moment. All right, so this is the workstation. Once you expose the images and do your manipulation of the images in the x-ray room, you're going to hit send and complete study, and this is where the studies send. So if you look up under here, under the image, the database, we have all the test subjects. Here you have the student test, or the test that we did with the students, and here you have the image that appeared when we were x-raying our markers. So as you can see, we did an x-ray of the marker of the R. One of the benefits of having a workstation is that you're able to manipulate the images. Remember, you have to be within 25% of a good technique in order to be able to manipulate an image to make it appear to be better than what it originally was. So I could right click here with my mouse, and if you look at the image, I'm making it lighter. See how it turned lighter? Or I can make it darker. Okay, so you see how the clarity of the R shows up better or worse, depending on what you're looking at. So you're able to post what we call post-process. And so there's all kinds of image processing that you can do here. You can flip the image. So if I hit flip horizontal, you'll see how the image moved. So this is all image manipulation. You can rotate it. See how I'm rotating the image. Vertically do it. Counterclockwise. Like I said, window and level to a better exposure. But like I said, the key thing to making a good optimum image is being within 25% of a good technique. If you're over that, you're not going to get a technique, which I can show you right here. This is overexposed. You can barely see the L marker here. So I'm going to right click to see if I can window and level it. You see as I'm making it lighter, you're not getting a better image. It's just a bad image getting worse. So I can't even see the L. Yeah, I can barely see it here. Even when I make it lighter, you can't see the end of it here. That's because it was overexposed and the image was burned out, so to speak. So that's why they were not within 25%. If they were within 25%, like on this image, see how if I make it a little bit lighter, you still see the L clearly. You still see the areas around it. I can make it even lighter, you can still see the L. I can make it darker and still see the L. Whereas in this image, where it was burned out to begin with, where it was kind of like that, I believe, you can't fix it at all. You can't see more, you can't see more. You're seeing less there. The other image that was within a good technique, I can make it darker or lighter. See how I still see the L? Here, as you get darker, it gets a little bit darker, but it's still, I was able to manipulate it to give them a good image. So that's one of the benefits of the workstation, image manipulation and post-processing. Thank you.